Please take your seats and silence your electronics. Our program is about to begin.
There's a haze on the horizon, babe. It's only been a couple of days.
Please welcome to the stage your event MC, David Lamont Wilson.
I'm walking on sunshine. Whoa, I'm walking on sunshine.
Good morning, Prevention Fields! Thank you for your patience. How are you guys doing? All right now, let me tell you, I have been the MC for this event for 22 years. No, listen. And believe me when I say this, I am so happy to see all of your faces right now. Now today, you're going to see examples of what prevention really looks like, but let me tell you, just the fact that everyone is in this audience right now today is a true example of what prevention resilience really looks like. So give yourselves a hand. Now, as you guys know, we always try to bring very exceptional programming to you. Today's event is no exception. And I wanted to start by introducing my boss, Christopher Carroll. He serves as the Principal Deputy Assistant Secretary for Mental Health and Substance Use at SAMHSA. Now, in this capacity, Chris provides overall leadership of mental health and substance use disorders, treatment, prevention, recovery services, and all of our agency policies. But the thing that I want to most emphasize about Chris is that he has over 30 years of leadership, and it's because of that leadership and him being instrumental in making sure that this day happened and that prevention always has a voice. So without any further ado, my boss, Christopher Carroll.
Wow. I am certainly not going to bring the same energy that David did, but I would like to point out that I am repping the great state of Arkansas. Where's my Arkansas? Woo pig, for those who know. Good morning, everyone. It's great to see you here today at SAMHSA's 22nd Annual Prevention Day. It's a great turnout, and thank you for showing up year after year, especially this year. I'm so honored to have so many champions of behavioral health with us. We are thrilled to have Secretary Kennedy join us here in a moment and look forward to his remarks on a major announcement. We also have a couple of other special guests that I would like to recognize. Both will give remarks shortly. Mrs. Catherine Burgum is here. Mrs. Burgum is the former First Lady of North Dakota and newly named co-sponsor of the White House Great American Recovery Initiative, signed by President Trump last week. She is a tremendous advocate for prevention and truly an inspirational recovery partner. Also, here's Assistant Secretary Alex Adams from HHS's Administration for Children and Families, or ACF as you may know it. Assistant Secretary Adams has been a forward-thinking and collaborative partner on many initiatives with us. So I thank them both for coming. To our partners in the room, thank you to General Price. He is somewhere. Rob Morrison and our colleagues at CADCA and NAZADAT. We are grateful for your long-standing partnerships as well as your dedication in advancing prevention science. And equally important, in this room, there are about 2,500 leaders in prevention, including the future of prevention, our young prevention leaders, with us from around the country. Thank you for being here. As we're gathered in this room, I'd like to thank you for your support and the work you do every day to prevent and combat substance misuse, abuse, and addiction. At SAMHSA, prevention is a priority, and all of you in the prevention workforce are our priority. Your work is powerful. You have the ability to change lives, to save lives, to create healthier communities. Intervening early not only means fewer people in crisis and fewer overdose deaths, it also means healthier choices by young people today. It means fewer behavioral health challenges like anxiety and depression tomorrow. And critically important, a lower risk of multiple chronic diseases in the future. Ultimately, prevention becomes the foundation for a thriving society. And coalitions like yours are crucial as we come together to make America healthy again. Now I'd like to take a brief moment to tell you a little bit of what I know about the Secretary. I know and have personally witnessed from day one his commitment to behavioral health and prevention. In fact, within days of Secretary Kennedy's appointment, he traveled to rural Virginia to meet with students and teachers about the impacts of cell phones and social media on children's mental health. Shortly after, he went to Kentucky to talk to families and children to discuss the importance of nutrition and its impact on our health and well-being, including our behavioral health. He also immediately renewed the public health emergency for the addiction crisis we face in America to ensure that states and organizations can access the resources and funding they need to end it. He also established the nation's first Make America Healthy Again Commission, which released the Make Our Children Healthy Again strategy shortly thereafter. And now, with the support of President Trump's new executive order on recovery, we will press on. We have worked for many months together to strive for better results and improved health outcomes for Americans in need, not only at SAMHSA, but across all of HHS. And in all of these historic endeavors, prevention is at the core. Secretary Kennedy has been a steadfast champion for improving the nation's behavioral health, especially for Americans struggling with addiction, and is a strong believer in the power of prevention. He has both a tremendous personal and professional commitment to recovery. Now is the time for all of us to step up. Resources and policies are being aligned, and the opportunity for the prevention community and behavioral health is here and now. With that, it's my honor to welcome Secretary Robert F. Kennedy, Jr.
Thank you very much for that welcome. And thank you to SAMHSA Principal Deputy Assistant Secretary Christopher Carroll for your introduction, and Assistant Secretary for the Administration of Children, Alex Adams, for your work on HHS policies that promote recovery and keep families together. I also want to thank the leaders and advocates that are here today. You engage in the service of recovery every day, and none of this would work without you. One of the, I have now 43 years in recovery. This is something I would say all of my recovery program provides the gravity around which the rest of my life circulates. It's something, I go to meetings every day of my life. I don't have time to go to meetings. I have a big job, and I just don't have time to do it, but I go anywhere. And I go because when I go, the rest of my life works. And for me, it's like brushing my teeth. When I first came into recovery, In 1983, I asked a guy, how long do you have to keep coming to these meetings? He said, just keep coming till you like it. And I've been coming for 43 years and I still don't like it. But I go every day because when I go, the rest of my life works. And it's because the secret sauce of recovery is service. You know, when Bill Wilson first got sober, he went to a program called the Oxford Group, which had 8 steps that were intended to induce a spiritual awakening. And he had the spiritual awakening, and his compulsion that he had been fighting an entire lifetime for alcohol just evaporated. And he could not imagine that he would ever drink again. And he went out to Akron, Ohio 6 months later after putting together this deal to buy all the vendors for the Goodyear and Firestone tire companies, and it would have made him a millionaire during the Depression and set him up for life. And he got out to Akron, Ohio, and the whole deal fell apart. Somebody else had come in and stolen the deal from him, and he was left standing in the lobby of the Mayflower Hotel. And all of a sudden, the entire compulsion came back to him. And he was 20 feet from the lounge, and he could hear the clinking of the ice and the laughter of the patrons. And they were calling to him to come in there and take a drink. And he had at that moment the central revelation of the 12-step recovery programs, which was the only way that he was going to stay sober that day, is if he found another alcoholic to help. And instead of going to the lounge, he went to the phone booth, and he started looking up preachers and hospitals and sanitariums and Salvation Armies looking for an alcoholic that he could help. And he finally found Dr. Bob. And they got together that night. Dr. Bob had tried everything. When he came to the meeting, he said, you got 15 minutes. And they ended up talking all night. And that was the first 12-step meeting. And the 12 steps that he designed after that are intended not only to induce a spiritual awakening, which gives you a daily reprieve from this compulsion, but also to do service every day. And that helps you get through the day. Oh, part of my recovery and everybody's recovery is to do service every day. And for you, that's part of your lives. And I come into this program with to this job with a complete commitment to making lives better for addicts and alcoholics all over the country, or helping them find their paths. To find their paths from isolation to community, to learn how to have relationships, to learn how to be of service to others. Because that is the road to recovery. And I have a lot of ideas about how to do that, but I also have an open mind. And we want to, throughout the next 3 years, hear from as many of you as possible. If you have ideas about how to nationalize this system and help government actually do its job of being helpful and supporting people in individual recovery, rather than doing a lot of things that government doesn't do very well. I also want to thank Catherine Burgum, who you're about to hear from. She's my co-chair of the White House Great American Recovery Initiative, which was created by President Trump. Catherine is a long-term advocate for the recovery community. Catherine dedicated her time as First Lady of North Dakota to confronting addiction and destigmatizing it, to confronting it, recognizing it as a chronic disease, which it is. Her leadership, her lived experience, her wisdom of being in recovery for 17 years is helping drive this administration's success. Today is Prevention Day, and this day reminds us of the importance of people like you, people who act early before crisis turns into catastrophe, before the emergency room visit, before the arrest, before child welfare visits, before a child ever gets access to drugs or alcohol. That work matters now more than ever. Substance use disorders cost this country an estimated $93 billion a year in direct costs. When we account for crime, healthcare costs, from all the collateral illnesses that afflict addicts and alcoholics, and the broader social cost, drug abuse drains nearly $920 billion from our economy annually. The real cost manifests in broken families, lost potential, and communities pushed to the brink. This is a crisis that affects every American family. I myself spent 14 years, beginning in my early teens, as a heroin addict before I found my way into recovery. My little brother, David, two of my nieces, and many other family members are among the casualties in the national epidemic of addiction and overdose. So I'm very much aware of the dimensions of the disaster of this national crisis. The epidemic of addiction feeds a national malaise of loneliness, of despair, and it amplifies the problems of mental illness and homelessness. For decades, our government response system refused to acknowledge these realities. We built programs in silos. We funded fragments instead of pathways. We waited for people to ask for help after they had already lost their health, their jobs, their families, their lives. That approach has failed. At HHS, we are changing the course. We are grounding our new policies on the hard-learned lessons of experience and of gold standard science. We're using evidence and not ideology. And we're treating prevention as our first responsibility because stopping addiction before it starts is the most effective intervention. Today, I'm announcing a comprehensive plan to strengthen prevention, expand treatment, all in accordance with the executive order President Trump signed last week to ignite the great American recovery. First, we're confronting addiction and serious mental illness on our streets. Substance abuse drives homelessness. About 37% of homeless people say that they have taken drugs regularly over the past 6 months. During the previous administration, homelessness reached record highs because the system encouraged people with severe mental illness and addiction to cycle endlessly between sidewalks, emergency room visits, jails, and mental hospitals and shelters. No one took responsibility for the whole person. No one stayed long enough to help them recover, to help them reestablish their links and teach them the lessons of how to live in a community. That system is neither humane nor effective. And that is why SAMHSA is launching Streets, Safety Through Recovery Engagement and Evidence-Based Treatment and Supports. Streets will invest $100 million in pilot programs in 8 communities that are prepared to lead to solve long-term homelessness issues, to fight opioid addiction and improve public safety by expanding treatment that emphasize recovery and self-sufficiency. These communities will build integrated care systems that move people from crisis to treatment, and then from treatment to housing, and from housing to jobs and stability. Streets will engage people continuously from first contact on the street through recovery, through employment, and through self-sufficiency. Law enforcement, first responders, courts, housing providers, and healthcare systems will work as one team, so people will no longer fall through the cracks. This builds on the $45 million SAMHSA awarded last year to expand sober and recovery houses for young adults. And for me, this is one of the critical parts of this program. I know so many people who have recovered in sober houses and recovery houses. And we need to make sure that after you go through the detox and the initial treatment, that there is that kind of housing support that allows you to reestablish your life, again, reconnect to community, get employment, and stabilize your lives. Second, SAMHSA will be dispersing $794 million to states with $319 million going to support comprehensive community mental health services for adults with serious mental illness and children with emotional disadvantages. Also, SAMHSA will distribute $475 million to the agency's Substance Use Prevention and Recovery Program in a block grant to prevent and treat substance abuse in the states. Third, we are expanding assisted outpatient treatment. Today, SAMHSA is announcing $10 million to support court-ordered outpatient treatment for adults with serious mental illness who meet our clinical criteria. This program is designed to work within the civil court system that supports engagement with community-based treatment as an alternative to more costly, restrictive levels of care, homelessness, and the interactions with the criminal justice system. And as we work out the kinks in this system, we will continue to expand it nationally. Assisted outpatient treatment works. It reduces hospitalizations, lowers incarceration and homelessness, and it improves safety and health concerns. Fourth, the Administration for Children and Families will allow states to use federal funding for FDA-approved medication-assisted treatment when a parent's substance use puts a child at immediate risk of entering foster care. Early treatment protects children and keeps families together. Finally, we are bringing faith-based providers fully into this work. HHS, and I want to say this is a chronic disease. It's a physical disease, it's a mental disease, it's an emotional disease, but above all, it's a spiritual disease. And we need to recognize that, and faith-based organizations play a critical role in, again, helping people reestablish their connections to community. Early treatment protects children. Finally, we are bringing HHS is opening funding opportunities as faith-based organizations that meet evidence-based standards, including through the state opioid response grants and mental health and substance use block grants. Faith-based recovery works, and we will support what works. The real work of prevention does not happen in Washington. It happens in communities, in your communities, and it happens because of your leadership. Let me be clear, prevention is practical, moral, and personal. In the months ahead, I will be visiting recovery houses, meeting prevention leaders in communities across the country and listening closely, and I hope to meet with many of you who are here today. Thank you for your dedication and your courage. On National Prevention Day, we honor your work. Every day, HHS stands with you to prevent suffering before it begins. Together, we will protect the vulnerable, restore dignity, and make America healthy again, spiritually, morally, and physically. Thank you very much.